Hello everyone, and thank you for joining the Specialty Pharmacy Times Expert Summit, Understanding and Exploring the Practice of Specialty Pharmacy. This program features an experienced panel that will dive into and discuss some of the areas of common interest related to specialty pharmacy. In addition, we will engage in conversations on two specific clinical areas of interest in specialty pharmacy, oncology and the treatment of hepatitis C. My name is Ray Tancredi, and I'm the Vice President of Specialty Pharmacy Development at Walgreens. Participating today on our distinguished panel are Cheryl Allen, Vice President, Business Development and Industry Relations for Diplomat Pharmacy, Nicholas Corrales of Elwyn Pharmacy Group, Stacy Ness, Director of Specialty Clinical Services for Managed Healthcare Associates, and Renee Rayberg, Senior Director of Clinical Consulting at Artometrics. Thank you again for joining us. Let's get started. Over the years, the definition of specialty drugs has evolved. From your perspective, what classifies a drug as specialty pharmacy drug, and how do you think that definition will evolve over the next 5 years? Cheryl?
You know, historically, we've looked at high cost, difficult to administer agents as being specialty. I think moving forward, we're really drilling down into the certain attributes of the product. We see drugs coming to market that, although their price points may be lower, these products do wind up in the specialty channel just because of the high-touch aspects that are needed. So whether it's cold chain, proper storage of the product, we will have to come up with a solution for these low WAC agents in addition to the higher cost agents that we will absolutely see.
Stacy?
I agree, Cheryl, and I think that it's also important to keep in mind that everybody really has their own definition of specialty. So whether it's a health plan, or it's a PBM, or if it's a specialty pharmacy, or even a patient has their own definition in mind of what constitutes a specialty drug. So I think that's a really important factor to keep in mind to ensure that everybody's talking apples to apples and ensure that you're starting off on that same baseline with a understanding of what the specialty drug means to that patient.
I know cost does play a role in a specialty drug. Is there a minimum threshold per prescription that we think a specialty drug should be?
That's tough. You know, CMS says $600, but you know, we do see products that patients will need assistance, and these products are a lower WAC cost, which causes issues in the channel. What we've done is partner with manufacturers to help support these products in the channel.
Very good.
And I think you also have the issue of drugs being used with a specialty drug that might have a lower cost associated with them, but are no less important to the treatment regimen. So I think it's important to look at that when you're looking holistically at the specialty therapy as well.
Very good. Any other questions or any other comments on that?
Yeah, I think the core definition of specialty is always around the patient and the driven outcomes of the medication that requires something special. It could be the handling, it could be the side effect management, and so on. The different stakeholders may change the definition a little bit by the cost or the access, if it's a manufacturer or a payer, but I think the ultimate definition has to be, or is focused around the patient.
Very good. Specialty pharmacy differentiates themselves and it really focuses on value. How does this align with the needs of the payers, providers, and patients? Renee?
So for the payers, obviously cost is the most important. So specialty pharmacies can offer contracted prices and usually lower prices for the specialty drugs. But patient access is also important, and also the services that come along. So patient education, injection training, and adherence support, which is so important to the payer, because if they're going to pay the money to invest in these specialty drugs, they certainly want their patients to take them and realize the full value medically.
Great. Cheryl, how is there differentiation between specialty and traditional pharmacy?
I think within specialty pharmacy, I mean, there's a tremendous need to educate the patient about the therapy. You know, we heard Renee say cost is very, very important to the payer. We find the most costly prescription is the prescription that the patient does not take. So educating that patient, having that patient understand from the beginning what their part in the role of the therapy will be is very important, very valuable to all the stakeholders.
Very good. Nick, how does specialty pharmacy do that?
So, you know, it's scary when you think about the third rule, where a third of the patients never take their medications, never get the prescription filled. a third of the patients take the medication incorrectly, and a third of patients are right on the money. So when you think about 2/3 of the population, when they receive a prescription, have an opportunity to take it incorrectly or not take it at all, specialty pharmacy has a tremendous opportunity. And the differentiating factors that a specialty pharmacy can offer versus retail are just extensive, from prior authorization and benefit investigation, side effect management, the list goes on and on.
Yeah, I think that just to add one other thing, I think it's also patient access, the ability for a specialty pharmacy to really dive into that benefits investigation and overcome the barrier of copay assistance. Many times the copays are very high for specialty drugs, and what a specialty pharmacy will do will hold on to that patient and really investigate the benefit and all avenues to get the patient service from a copay, whether it's the manufacturer copay program, whether it's a foundation like Chronic Disease Fund or NORD, or I mean, there's times when specialty pharmacy will go to a patient's church to get assistance. So I think that's a real big differentiator for specialty. I think